Hello and welcome to Behind the Insights, where we pull back the curtain to share real-world data, AI, and evidence generation insights from the industry's top thought leaders. I'm Marie Demko, and in today's episode, we're diving into a complex and often misunderstood condition, treatment-resistant depression, or TRD, with someone who's truly at the forefront of innovation in this space. Joining us is Dr. Carl Marci, Chief Clinical Officer and Managing Director of Mental Health and Neuroscience at OM1. Welcome, Carl. It's great to have you here today.
Well, thanks for having me, Maria.
So let's start by setting the stage. What is treatment-resistant depression, and why is it so challenging to define and detect in real-world settings?
Treatment-resistant depression, or TRD, at a high level is exactly what it sounds like. It is when a person or patient with clinical depression receives an approved therapeutic intervention and they fail to respond or fail to go into remission. Classically, this has been defined as the failure of 2 or more antidepressant medications of adequate dose or duration during a single depressive episode.
How common is it for patients to experience failure with multiple treatments?
Oh, it's very common. Many patients suffer from TRD, with prevalence rates ranging from 5 to 50% of patients falling into this category. The economic cost of TRD are extraordinarily high, with estimates between $30 and $50 billion annually, which represents nearly half of all the costs associated with depression in the United States. So it is a very large problem.
Now, let's talk about a real-world case study. OM1 partnered with a leading biopharma company to uncover treatment-resistant depression patients in real-world data sources. Can you explain how AI and unstructured clinical notes were used to highlight physician-attested TRD?
We used our patented phenome AI model to identify patients with TRD. In order to do that, we start with a gold standard. In this case, we used what we call clinician attestation. We identified patients using medical language processing when an actual psychiatrist wrote in the chart that the patient was suffering from TRD. We then modeled those patients using our AI, and what we found was extraordinary. Only 1% of patients met both the AI model and the classic definition of 2 antidepressants of adequate dose and duration. So that was a little concerning.
Can you walk us through how you know which definition is correct?
Well, it's a good question. With that low of overlap, how do we know? So we used the OM1 premium data set for major depressive disorder to build the model and run the study. At that time, we had nearly 500,000 patients with MDD, or major depressive disorder, who also had relevant notes in the electronic health record. Fortunately, we also have a large number of PHQ-9 scores, which, as you know, is a measure of depression severity. We found that the more likely patients were to be depressed according to the AI model for TRD, the more depressed patients were according to the PHQ-9. This is very consistent with what we see in the literature. However, for the classic definition, there was no relationship between disease severity and whether a patient met the definition. This tells us that the AI definition is likely more accurate.
Looking ahead, how do you see AI evolving in the discovery and treatment of TRD?
We are working with our partners in industry, conducting and publishing research using our real-world data for a variety of existing and novel treatments for TRD, ranging from the use of pharmaceutical-grade psilocybin, augmentation with third-generation antipsychotic medications, and esketamine nasal spray. All of these are using our AI models to some extent to help advance treatment for patients.
With AI playing a bigger role, trust becomes a key factor. How do we ensure trust, accuracy, and clinical relevance when using AI to identify patients, especially in complex mental health conditions?
Well, here at OM1, trust starts with transparency and high-quality data. Our patented models use highly curated and de-identified data that uses industry-standard safety and security protocols, and we have published or are in the process of publishing all of our AI models in the peer-reviewed academic literature.
If you had to summarize the future of mental health innovation in one sentence, with AI at the center, what would you say?
Well, I'll give you 2 sentences. I would say, with a few exceptions, the future of mental health with AI at the center is quite bright. I see a world where high-quality data and AI models are helping to bring new treatments to market faster and improving our understanding of complex mental health issues like treatment-resistant depression.
Great. Thank you so much for sharing your insights today with us, Carl.
It's my pleasure.
To our audience, thank you for tuning in. You can find more information on OM1's Mental Health Data Network and Phenome on our website, om1.com, or follow us on LinkedIn, Facebook, and X. If you'd like to be notified about our next episode, be sure to subscribe to our email list to stay updated on the latest insights. Thanks again for joining us, Carl, and to everyone watching, we'll see you again next time.